Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Struvite stones, or we can also call it as infection stones. These Struvite stones or infection stones, they grow mainly in the alkaline medium. These Struvite stones will grow in the alkaline medium because alkaline medium is important for their growth. So this alkaline medium is mainly provided by the Proteus infection. So when they form the stones, these stones which are seen, these stones are very large, and thus these stones will fill the entire pelvic calyceal system. When they fill the entire pelvic calyceal system or entire pelvis of the kidney, this will result in the formation of Staghorn Calculi. So these Staghorn Calculi are hallmark for struvite stones, and these are formed in high concentration of ammonia. When there is high concentration of ammonia, obviously there is high alkaline urine, so thus they are found in high concentration of ammonia. They are most commonly seen in women. Why are they most commonly seen in women? Because women has increased susceptibility of the urinary tract infection. Why are women more susceptible to urinary tract infection? Because of the presence of short urethra. Women actually has short urethra. Because of the short urethra, they are more susceptible to urinary tract infections, and they are more susceptible to Proteus infections also. Because they are more susceptible to Proteus infections, obviously there is increased chances of struvite stones. Then these struvite stones which are seen, these are mostly, they are silent or asymptomatic. Okay, they are asymptomatic and slowly they cause progressive destruction of the renal parenchyma will occur slowly. And what are the causes or conditions where there is increased predisposition to struvite stones? So, causes or risk factors of struvite stones. Struvite stones are seen in the presence of foreign body. Whenever there is foreign body in urinary tract, like in Foley's catheter. Whenever you put a Foley's catheter, obviously you are introducing an external material from an outside. So this will predispose the person to urinary tract infection. In neurogenic bladder, there is increased risk of urinary tract infections. In bladder dysfunction and also in bladder outlet syndrome, there is increased risk of urinary tract infections. Because of this increased risk of urinary tract infections, these struvite stones are associated with increased risk of urinary tract infections, thus resulting in struvite stones in these conditions. Then management of struvite stones. Fine. If there is struvite stones, first and foremost, we should try to remove the struvite stones completely. Number one, this is first step. First, we should remove the complete struvite stone. Second, you should treat the metabolic abnormality if any. Third, you should correct the anatomical abnormalities. So these are the main things. First, you should completely remove the stone. Second, you should treat the metabolic abnormality. Third, you should correct if any anatomical abnormalities are present. Then, what do you do? In order to first remove the stone. For removing the stone, for removal of stone, we can do percutaneous nephrolithotomy with extracorporeal shock wave lithotripsy is done. This is the best treatment option for the removal of the stone. Then, in order to prevent the recurrences of the stone, we can give antibiotics are given. These antibiotics will mainly are given to prevent the recurrences of the stone, or they will also prevent the growth of the stone after operative procedure. So to prevent the stone recurrences and to prevent the growth of stone after the operative procedures, we give these antibiotics. Then we should treat the metabolic abnormalities. So for then second we should treat, so first we have removed the stone, second we should treat the metabolic abnormalities. So in the metabolic abnormalities, so treat metabolic abnormalities. In metabolic abnormalities, first we can do acetohexamic acid is given. What is this acetohexamic acid? This is an irreversible inhibitor of urease. This acetohexamic acid will decrease the likelihood of precipitation of the disease, because here the stone is a struvite stone. So this is a irreversible inhibitor of urease, and thus it inhibits the high ammonia concentration is also increased. So low phosphate and low calcium diet is recommended in these patients, and up to then this is the main treatment. Then then up to almost 50% of patients can have uh, urinary stone recurrences, or they can have UTI over 10 years. If you follow up the patient among over the 10 years of time, that most of the patients will develop urinary tract infections.
Thank you and thank you for watching.